Hello, my name is Pamela Ruiz. I am the Chief Business Development Officer from Intelios. I'm very pleased to be presenting to you from the Washington, D.C. area in the United States. My thanks to Guillermo Armenta for inviting me to present at Global Digital Week. My presentation is entitled Real World Learning for Real Life Health. So first, an introduction. Who is Intelios? We are a nonprofit organization that validates clinical proficiencies through assessments requiring education and training towards the highest level of achievement, which is certification. We have been established since 1975, and we are accredited through the International Standards Organization, or ISO, based out of Geneva, Switzerland. Most importantly, we are a community partner that aligns and serves the needs of the country and/or region to create positive impact for transformational changes in global health. And finally, we are an innovator in the certification and ed tech spaces in order to achieve that impact. Our first area of impact that I'd like to draw your attention to is for maternal fetal health. The United Nations Strategic Development Goal number 3 is based in good health and well-being. Specifically, number 3.1 states, by 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. A few data points for your consideration. This data is based on Nigeria, and the leading causes of maternal death are obstetric hemorrhage, eclampsia, sepsis, and complications from unsafe abortions. In 2017, which is the latest data available, 917 women died per 100,000 live births. That's nearly 1%. There were 67,000 maternal deaths, which is nearly 1% of the entire female population of Nigeria. Nigeria does account for 20% of all maternal deaths globally, and yet up to half of these deaths are preventable. As a point of comparison, in South Africa in 2017, 119 women died per 100,000 births. There were 1,400 maternal deaths, just a fraction of the total female population. And a point of note, more than 60% of births in Nigeria occur outside of health facilities without the presence of a skilled birth attendant. So gaining the trust and aligning with existing community-based organizations and working directly with the women and the women who care for them will be key. I'd now like to draw your attention to the World Health Organization Global Strategic Directions for Nursing and Midwifery Report 2021 to 2025, and specifically the 4 strategic directions outlined. 1, educating enough midwives and nurses with competencies to meet population health needs. 2, creating jobs, managing migration, and recruiting and retaining midwives and nurses where they are most needed. 3, strengthening nursing and midwifery leadership throughout health and academic systems. And 4, ensuring midwives and nurses are supported, respected, protected, motivated, and equipped to safely and optimally work within their practice settings. And our role as Intelios is to provide customized curriculum that matches the scope of practice and resources for midwives and skilled birth attendants. Implementing a training curriculum that uses both a hybrid of online and in-person models to meet rigorous certification requirements. Providing a customized maintenance of certification program for continued quality assurance and lifelong learning. And finally, clinical and economic sustainability through maintenance of certification programs and train the trainer programs to grow the professional network and quality of maternal fetal health, directly impacting the Sustainable Development Goal 3.1. We do this through innovation and customization. By providing remote platforms and apps, we are able to work with local subject matter experts and be able to meet them where they are. Their time is used more efficiently, and they have broader access to us, and we have broader access to them. We are able to use simulated images and cases for our education, training, and assessments. We offer diverse eligibility pathways to increase access to qualified clinicians. This means that in order to be able to sit for certifications and assessments, we are able to look at the work that they do on a daily basis and say, yes, you're doing the work. You are in fact qualified to sit for this exam in order to validate your proficiency. We bring together a real ecosystem of education, customization, and that clinical training so that education and assessment is not a barrier to being able to prove your skills and prove them and improve your skills. We crowdsource content and real-world practice cases by working with these subject matter experts. And finally, we use artificial intelligence for test creation and modification based on that original subject matter expertise. So our impact, modeled after the 4 strategic directions previously discussed. By educating skilled birth attendants in the use of diagnostic ultrasound, this will provide an efficient diagnosis for women and a correct and quicker pathway to care. Creating additional personal and clinical practice opportunities with career growth for this predominantly female workforce. Strengthening nursing and midwifery leadership throughout health and academic systems with validated skill sets to mitigate risk. That midwives and nurses are a part of a collaborative team for women's healthcare, resulting in positive economic impacts on healthcare institutions and communities. And at this point, I'd like to draw your attention to the Ultrasound Proficiency Grand Challenge. This challenge states that by 2030, every user of medical ultrasound in the world will be proficient and certified, ensuring patient safety and increasing equity in healthcare.
Ultrasound is a powerful medical imaging tool used to detect and diagnose medical conditions in men, women, children, infants, and fetuses. Ultrasounds performed by educated and trained healthcare providers who have verified their knowledge, skills, and abilities increase the quality of care, improve patient safety, and save lives. Until recently, most patients received ultrasound care in hospitals, medical centers, doctors' offices, and clinics. In the last few years, thanks to innovative device manufacturers and technology advances, new, powerful, affordable, and handheld ultrasound machines have been developed. These new pocket-sized ultrasound machines are quickly making their way into the hands of medical providers in every imaginable healthcare setting around the world. The possibilities for better patient care and improved global health are boundless. But technology by itself is not the only answer. We must assure that all healthcare providers that have access to ultrasound technology also have the critical ultrasound education, training, and verification of knowledge, skills, and abilities vital to deliver quality patient care. The lives and futures of patients around the world are counting on us. This is the Ultrasound Proficiency Grand Challenge. We believe that by 2030, every person everywhere in the world should have access to ultrasound care from educated and trained medical professionals that have certified their knowledge, skills, and abilities. We invite you to join us in the Ultrasound Proficiency Grand Challenge. Together, we can build a healthier and safer world for all.
As you can see, we have a broad ecosystem impact. For the patients, they have broader access to imaging provided by clinicians, midwives, and skilled birth attendants who will know what they're doing. Providers have access to education and training and the validation of their skills. Healthcare systems will be able to mitigate risk by having more people who have the skill set to be able to provide this type of patient care. And finally, the broader community and local economy has positive impacts. The women that are working in this capacity, the additional women who are trained to be able to work in this way, the positive economic impacts that this will allow different communities. So finally, we are seeking community collaboration to broaden this impact in different areas. We're specifically looking for individuals and organizations that believe in the positive ripple effects when women's healthcare is prioritized in communities. We're looking for ed tech companies to help drive innovative technology to meet global challenges of access and inequity in clinical care and education. And finally, we're also seeking funders willing to support through our nonprofit Intelios Foundation and other aligned organizations. To be clear, we are looking for a sustained impact, something that will continue on for years and years. Thank you. For more information, please see intelios.org. Additionally, inteliosfoundation.org, and finally, intelios.org/Grand Challenge. I can be reached directly at pamela.ruiz@intelios.org. And one more slide. If you'd like a bit more information, please find here our sources. Thank you again for this invitation to present. It's been a pleasure. Thank you.